Depressive disorders in psychology is a depressive disorder called Premenstrual Dysphoric Disorder, often referred to as PMDD for short. So let's just read the definition. Changes in mood, irritability, dysphoria, and anxiety that occur during the premenstrual phase of the monthly menstrual cycle and subside after the menstrual period begins for most of the cycles of the preceding year. Okay, so now that we know the definition, let's read about PMDD. Females who experience depressed mood or changes in mood, irritability, dysphoria, and anxiety during the premenstrual phase that subside after menstruation begins for most of their cycles of the preceding year may be diagnosed with premenstrual dysphoric disorder. So basically, if for the whole year before, the whole preceding year before, before your period, you were experiencing a lot of mood problems like depression, irritability, dysphoria, and anxiety every single time before your period for 1 year, but once you got your period, it would go away, then you may be diagnosed with premenstrual dysphoric disorder, aka PMDD. This disorder can carry with it the risk for increased suicidality, and not only through the days or weeks just prior to the beginning of the menstrual period. Okay, so that means that you could be at risk for suicidality even if it's not during PMDD time. Okay, it just increases your risk. Critics argue that the PMDD diagnosis pathologizes the normal variations in mood that can occur over the course of a person's monthly menstrual cycle. However, the counter-argument is that the majority of people who menstruate do not experience monthly mood alterations that are so severe that they would show such extreme symptoms. Basically, what it's the critics who are giving a counter argument to the critics who argue about PMDD are saying that like moods that are that severe are unusual. And so yes, we do need a PMDD diagnosis. Including PMDD as a diagnosis allows those with these severe episodes of depression to receive treatment that might not otherwise be available to them, right? Because you have to be like diagnosed with something to be able to be prescribed medication. And so if an individual is suffering with these things on a monthly basis, then yes, like they should be able to receive, medication if that's going to help them. Okay, so that was one of the depressive disorders, premenstrual dysphoric disorder, PMDD.